Hey everyone, and welcome. Today, we are diving deep into reproductive system medications. Now, this is a topic that comes up a lot on the PTCB exam, so let's make sure you are totally ready for it. Here at PTCB Prep Guide, our whole mission is pretty simple. We take these complicated pharmacy concepts and just break them down into easy, memorable lessons. The goal? To help you walk in and ace that exam. All right, so here's the game plan for today. We're going to kick things off with a quick overview, set the stage. Then we'll jump into the high-yield antivirals, talk about bacterial STDs, and then cover some really common infertility drugs. And to finish things off, we'll do a rapid-fire review, and I'll give you some final exam tips to make sure all this stuff really sticks. Sound good? Let's do it. Okay, first things first, we've got to build a solid foundation. I promise if you get the basics of how the system works, remembering all the medications is going to be so much easier. So let's do a super quick refresher. For males, the testes, they're producing testosterone and sperm. For females, the ovaries are producing estrogen, progesterone, and eggs. And the thing controlling all of this? That's the pituitary gland. These hormones, they're the main characters in our story today. So now let's see how different medications come into play. Okay, listen up, because this section is absolutely critical. Antivirals for STDs, this is a huge topic on the PTCB. You've got to know these drug names, both the generic and the brand. No excuses. So, we're going to start with HIV. That stands for Human Immunodeficiency Virus. And just like the name says, it's a virus that goes after the body's immune system, which is why managing it with the right meds is so incredibly important. Okay, so here are some of the main players when it comes to HIV treatment. You're going to see drugs like zidovudine, which has the brand name Retrovir. That one's a classic. Then there's tenofovir or Viread. We've got saconivir, which is Inverase, efavirenz, brand name Sestiva, and then there's a combo drug, lopinavir plus ritonavir, which you'll know as Kaletra. Seriously, making flashcards for this list is probably one of the best things you can do. And hey, check this out. Here's a great little memory trick for you. Look at the names: Retrovirs, Inverase, efavirenz. See that VIR in there? That is a massive clue that you're looking at an antiviral drug. Trust me, that little trick can be a total game changer on exam day. All right, next up, let's talk about genital herpes. This one's caused by the herpes simplex virus, and it's famous, or maybe infamous, for causing those recurring outbreaks. Now, it's important to note the meds we're about to see don't cure the virus, but they are really good at managing and suppressing those outbreaks. And guess what? We've got another awesome pattern to memorize here. The drugs for herpes, they almost always end in the suffix clovir. You've got acyclovir, brand name Zovirax, famciclovir, brand name Famvir, and the one you'll see all the time, valacyclovir, brand name Valtrex. You see that clover at the end? Boom. That's your signal for herpes antiviral. Super helpful. Now, this next point is a really important counseling point for you as a technician. It's something you absolutely need to know. The herpes virus can actually be spread even when there are no sores visible. And while condoms definitely help reduce the risk, they don't make it zero. This is major patient safety info right here. Okay, let's move on to HPV, which stands for Human Papillomavirus. This is an incredibly common virus, and it's linked to two main health problems: genital warts, and much more seriously, it can cause cervical cancer. So, with HPV, there are really two different ways we approach it: prevention versus treatment. Prevention is all about stopping the infection from ever happening. That's where vaccines like Gardasil and Cervarix come in, and they work best when given before someone becomes sexually active. Treatment, on the other hand, is for after someone's already infected. It doesn't get rid of the virus, but it manages the symptoms, like using special acids or freezing to get rid of warts. All right, let's switch gears for a minute. We've been talking about viruses, now let's talk about bacteria. The way we treat these is totally different, and honestly, what you need to know for the exam is a lot more straightforward. So when you think about bacterial STDs, things like chlamydia, gonorrhea, syphilis, the #1 takeaway for your PTCB exam is super simple. They are treated with antibiotics. You don't have to memorize a giant list of them, but you might see a script for something like azithromycin or doxycycline. The main thing is just to connect those conditions with the word antibiotics in your brain. Okay, let's pivot now to a different, but still related topic: infertility. The medications we'll look at here are all about helping to address the different things that can make it difficult for someone to conceive. So what is infertility officially? Well, it's just defined as having difficulty conceiving a child. And it's really important to remember this can be caused by all sorts of factors affecting the man, the woman, or sometimes a combination of both. Okay, so here are the high-yield infertility drugs you'll want to have on your radar. The biggest one, the one you'll probably see the most, is Clomiphene, brand name Clomid. You might also run into human chorionic gonadotropin, which is Pregnyl, and Letrozole, brand name Femara. And yeah, I'm going to say it again, flashcards are your best friend for these. All right, that was a lot of info, I know. So how about we put that knowledge to the test? It's time for a little quick recall quiz. Let's see what's stuck. You ready for this? Okay, first question. A prescription comes into the pharmacy for valacyclovir. What brand name bottle are you going to be looking for on the shelf? I'll give you a second. If you said Valtrex, you got it. See, that Clovir suffix trick works. All right, next one. A patient at the counter mentions they're taking Clomid. What's the generic name you should know for that drug? Yes, it's Clomiphene. That's that key infertility drug we talked about. Nice work. Okay, last question. Let's really lock this concept in. That Clover suffix we keep talking about, it's a huge clue for drugs that treat which specific viral infection. Bingo! Genital herpes. Acyclovir, valacyclovir, they all fit that pattern perfectly. You guys are crushing this. Excellent work. Seriously, you did a great job on that little review. You are absolutely on the right track to mastering this stuff and walking in to pass that exam. So let's just wrap up with a couple of final tips to make sure all of this sticks in your brain. So here's your path to success. It's just 3 simple steps. 1, review the notes you took today. 2, if anything felt a little fuzzy, just rewatch this. Repetition is everything. And 3, and this is a big one, practice those drug names every single day, generic and brand. It doesn't have to be long. 5 minutes a day makes an enormous difference. You did an awesome job today, for real. You are one big step closer to knowing all the medications you need for that PTCB exam. Hey, if this lesson helped you out, do me a favor and hit that like and subscribe button. We post a new simplified topic every single day. Keep on learning, keep practicing those drug names, and never forget, you've totally got this.